Hello, 5 Awesome Realist fans. My name is Jake, and I am here today to talk to you about the healthcare system. Woo! So, I live in Canada, just in case nobody knows. First things first, Canada has a free healthcare system. Now, you may be asking yourself, Jake, what do you mean free healthcare? Well, let me explain it to you. It's where we Canadians don't have to pay for, like, going to the doctors. We can go to the doctor and not have to pay for it. However, we have to pay for the prescription or an anti-inflammatory or whatever they prescribe for us. But that's only if your medical insurance from your job does not cover it. And it may cover a part, but you still have to pay. I'm not sure how it works in America, but I'm letting you know how it works here in Canada. Obviously, the best way to have the best health care would be to have a doctor. But lots of Canadians are currently without a doctor because of the shortage of doctors, obviously. Now, I'm going to let you guys in a little secret about me. I have been waiting for a doctor for 4 years. And when I called in October of 2009, they told me that there are still people from the list, on the list from 2001, which means that that's another 3 years if every single one of those person dies or gets a doctor. That means that that's at least another 3 to 4 years before I'm ever to see a doctor. Anyways, aside from the doctor wait being so long, that's not the only thing that is. That's what she said. The walk-in clinics are averaging about 2 to 6 hours waiting time, depending on how many people are there before you get there. And people like me who are currently without a family doctor have to go to the walk-in clinics. Yes, it is free, but the fact still remains that you don't know how long you're going to be there for. So you better be going after work or calling in sick because you could be there for 8 hours. Who knows, maybe even longer. I'll give you guys a perfect example. I had an ingrown hair. So, first, I didn't know it was an ingrown hair. It was just this red mark and it was really warm and irritated on the back of my leg. So I went to the emergency and they sent me up to see a doctor, and he made me an appointment. And apparently when you have an appointment, you get in there faster, which means that instead of waiting 2 hours, you still have to wait 1 hour and 45 minutes to see the doctor. But after I finally got in, and after a couple more visits, they finally decided to freeze my leg, cut open the leg by the little inflamed part, squeeze out the pus, and then they stitched it back up or put a band-aid on it. I don't even know what they did. I couldn't see. Now, I didn't have to pay for any of that. It was kind of like it wasn't really a mini surgery. It was more like a mini cut your leg open and you walk home. That's what it was. And I didn't have to pay a red cent for that. The only thing that I had to pay for was inflammatory, which was expensive. Now, does this mean that Canada's healthcare system is better than everybody else's? I mean, judge your health system based on what I am kind of telling you. A 2007 study shows that Canadians are bound to live about 3 years longer than Americans. Like I said, you be the judge. Canada's healthcare system or yours? But anyways, that's all I think I have to say for this Wednesday video. And I'll see you later. Okay, bye.
She called the doctor, woke him up and said, "Doctor, ain't there nothing I can take?" I said, "Doctor."